Alright, today is Thursday, September the 13th, and just a quick update on Zach and how things are going with his cancer treatments. He had chemotherapy, as you know, last Thursday. Got a little sick over the weekend. He thought it may have been from reactions to chemo, but it turns out, in his opinion, that he looks like he was having some issues with the Oxycontin he was taking for pain management after he had all the GCFS booster injections, where his body was going back into normal mode, so to speak, with the bone marrow being in overdrive to produce stem cells. We were told that he was going to have some deep bone pain, so looks like that was the case. He was trying to take some oxy to combat that, but he ended up feeling more sick than he just figured he'd just deal with the pain right now, as opposed to getting nauseous all the time. So he hasn't gotten sick since the Sunday or so. Been doing well, eating well, looking a lot better, so that's a plus. Yesterday, which was Wednesday the 12th, we went up to Seattle Cancer Care Alliance to talk to them about his bone marrow transplant. Went over his history a little bit about how it was discovered that he relapsed and came back into an aggressive form of Hodgkin's lymphoma. The doctor wanted to get some more information from Zach, like an example of how he was feeling, how the history behind how he found out his symptoms, all the tests, talking about test results such as the echocardiogram, PET scan, CT scan, echocardiogram, the whole 9 yards. Also discussed how it's pretty awesome that in the last couple of weeks the tumor shrunk in his chest by about 40%, so the doctor was very encouraged by that. Also told us about what's to be expected with the bone marrow transplant, how long he's going to be in the hospital for, and it looks like Zach may be in the hospital for at the most 30 days, so that's a plus, that's a positive, because we expected to be in there a little bit longer than that. Additionally, the doctor also told us about someone he just recently treated who was about mid-teens, who had an even more aggressive form of Hodgkin's lymphoma than Zachary, and he was able to, that young boy or that young teenager was able to go into remission, not necessarily in remission, but he was able to get the bone marrow transplant similar to what Zach's going to have, and he was able to go home within 14 days, and now he's on a maintenance program to hopefully keep the Hodgkin's away or suppressed for as long as possible, and hopefully it'll be a long-term remission. So that was encouraging as well. So basically the doctor told us they're going to go ahead and do 5 to 7 days of a very aggressive form of chemo known as BEAM. I need to look up the acronym, but basically it's going to wipe out Zach's immunities, it's going to wipe out his bone marrow, it's going to cause some other physical side effects such as sores in the mouth, which it's not going to be very comfortable for Zach. Of course, going into the bone marrow transplant, Zach will also need some other tests to make sure he's not infectious, doesn't have any type of bacterial infections, doesn't have any type of virus infections, so that has to be all taken into account before he goes in for the bone marrow transplant. So after the 5 or 7 days of the BEAM chemotherapy regimen, that's when they'll reintroduce Zach's stem cells into his body. We were told that the agent that's used to thaw out the stem cells as it goes back into the body will somehow go in through his respiratory system, which I got completely lost how the doctor explained it, but he mentioned to Zach, just to give you a heads up, you're going to have this really interesting smell as the stem cell which the agent that causes the thawing of the stem cells is going to be exited out of his respiratory system, and so he may have this really weird cream of corn smell going on for about 2 or 3 days. So that's going to be interesting to see. And the doctor said that I would be able to smell it too, because it fills the room up, so that's kind of awkward. The doctor also mentioned that he's going to put Zachary on some super drugs, one known as CD30, which is, from what I understand, it actually attacks the membrane of the tumor that's actually in Zach's body, which will then basically allow for another super drug called PD1, Papa Delta 1, to actually go in and attack the cells and the molecule structure of the cancer cells and destroy them as they go back into the tumor. So there could be a lot more to it than I'm trying to explain, but being that they're doing targeted drugs now for tumors and cancer cells is pretty incredible. The doctor at SCCA said that the ultimate goal, hopefully one day, because they're going to actually put Zachary into a trial program, not really a trial program, but they're actually going to keep an eye on him, and they're going to do a case study with him where they're hopefully one day that the accepted methods today of chemotherapy for Hodgkin's lymphoma will be a thing of the past. The new super drugs they're going to give to him will hopefully be the new protocols, as well as getting rid of radiation therapy, because they have found that radiation is about a 50-50 when it comes to eradicating the lymphoma cells. So being in this situation where we're at a facility that provides cutting technologies in regards to new drugs is pretty incredible. So today, the 13th, Zach just went in for lab works. We were told his blood levels look good. The only concern is that his platelets are a little low, and if he experiences any type of bruising, little pinprick rash looking things, that's capillary bursts, bleeding from his nose, his teeth when he brushes his teeth, or in his urine, that we need to call the doctor so they can give him a platelet infusion right away, so that way it doesn't cause any other issues. But other than that, Zach said he's feeling great, he's looking good, and he won't have to go back in for another week. So he basically has a whole week to just relax and do whatever he wants. Next Thursday is clinic, and also the start of the next round of chemotherapy. So we'll be at the hospital for most of the day next Thursday. So that's where we're at right now. Things are moving along pretty well. Things are moving along really good. Yeah, that's pretty much it for right now. So again, thanks for everything that you guys have been doing for us. Thanks for supporting us. Thanks to everybody who's been donating through our GoFundMe account. I really appreciate it. And until next time, take care of yourselves, be good to one another, and I will talk to you soon. Thanks.